No stranger to CHI St. Joseph's Health and Primary Care. Beth Hirt, how you doing?
Great. Thanks for having me.
Fun to have you here and, of course, talk about all the great things in our community. And CHI St. Joseph's Health plays such an important role in our community. And now having the primary care unit being able to provide additional services is pretty big.
Yeah, it's huge. Yeah, I had all my kids here at the hospital too, and it's great just to have people that you know and taking care of you. So it's nice just to keep expanding on that role.
Well, the whole focus too is CHI St. Joseph's, the hospital, of course, we know, the ER services, but it's also important to get that primary care role and taking care of the family, and you get to know each other very, very well. And of course, you're in the community, so just trying to make everybody in our community more healthy. And you are a physician assistant, of course, in the primary care setting.
Correct.
It's a big role.
It is a big role. Yeah, there's a lot of responsibility.
Originally from Park Rapids?
Correct.
Yeah. Yep. So the brain gain, go away, come back kind of thing, and then come on back and then be part of a great medical facility.
So yeah, I grew up here and did my schooling, some undergrad at University of North Dakota, and then University of South Dakota is where I did my PA school and ended up coming back. It's been great.
Yeah, I told Sonia we were going to get along very well because University of North Dakota grads. Yeah, so we love that school.
Yes.
So you can also find when you, having grown up here, you know a lot of families, being able to provide that primary care for a lot of people your paths have crossed in the community, it's very rewarding, isn't it?
It is. Yeah, it really is nice to know people like on a personal level and then professional too. And I think sometimes it helps even the patients because they trust you sometimes a little bit more. So they're very open and really looking for help with their health.
You know the families a lot of the time, so you had a little family history, so you could ask a question. It becomes more inviting, I think, is when you grew up here, when we have a few candy stores too, by the way.
Yes. Right.
So not only do you get a treat, but you also get to get treated to great medical services. Kind of goes full circle, and people feel like it's very easy to open up.
Yeah. Yep. Absolutely. I think it's really nice for people when they just feel welcome and inviting. And healthcare is always evolving and changing, but I think people want to feel like they're really being heard and their voices are being heard and their concerns are being addressed. So I think it's nice when you can have that personal connection. They feel like they're getting exactly the care they need.
I'm guessing you're busy.
Yes, it's been busy.
Yeah, so it's done very well. And, of course, we visited, of course, with Monum, with him, and then also... Beretta, yes, thank you. The strong relationship in your primary care is very important to your overall health care, isn't it?
Yeah, it really is. We're, find a lot of the underlying things, right? And often the catastrophic things happen because something small was not checked, right? Your blood pressure wasn't checked. Your diabetes was out of control. So our job is to, of course, try to keep all of those things in check so those bad things don't happen.
Well, and I think, that's important too, is whether it was Dr. Monum, Beretta, we've talked about, listen to your body. If something's not right, listen to what your body's saying, and then seek help from your primary care and say, hey, I've been experiencing this, and that. Oh, well, let's do this test. Let's do this. It's really amazing where things have gone in the medical field. You can home in pretty quickly, medical record sharing and stuff that is right at the fingertips. So a doctor, whether you're at another place or you get those records and you can look at it really quickly, you can home in on it and also get them the care they need. Maybe it's a med. It's a reduction in a med. Maybe a med has ran its course with you and it's something new. All that's tough stuff.
Yeah, exactly. There's a lot that does go into it. So yeah, it's just figuring it out. And, sometimes too, even just with the way of the world and the internet, right? Everyone self-diagnoses. So everyone comes in and they have cancer, right? So it's kind of nice, even with primary care, you can even rule some things out. And sometimes people just need reassurance that...
Well, ChatGPT might be a tool. Quit playing doctor. Listen to a doctor, right?
Yes, 100%. Yes.
Oh, my God. Yeah. We all know it. But yes, it's a tool. But again, then you got to seek good advice because while you might convey it differently, they might be quickly as simple as looking at your hands and looking at, simple things that that obviously your training has brought to you will really home in quickly. Well, use the tools, but then say, this is what I'm experiencing. It allows you to kind of find, but if you read it, sometimes it scares the weebie-jeebies out of you too.
Right, exactly, 100%. So that's just it. We do a physical exam, of course, and then just getting sometimes some simple blood work is enough to really go one direction or the other. But I have to dig more, or like I said, just reassuring patients that they're not dying with cancer.
Yeah, and the other side of it, is seek your routine annual care.
Yes.
Do your annuals.
Yeah.
And especially if you are taking some blood pressure medicines, cholesterol, go annually.
Yes.
I mean,
yes. Once a year, everyone should be in just to get those routine things checked. I mean, it's amazing how many lives have probably been saved by somebody just doing a routine checkup, and they found something small and it never got big.
The stuff they can tell by just doing a complete, medical makeup on that and going through the panels. Hey, a year ago you were here. We got to figure out what's going on here. Or, hey, you've made tremendous progress here. We can maybe reduce this med a little bit. There's a lot of things that it tells you, and that annual checkup is so critical.
Yes, exactly. Plus, those annual reports do kind of, as you said, but they give us a good baseline too, right? So, it looks for any changes in things, but also we know where we're starting too.
Important to overall health is to get your primary care each and every year, do your annuals and take care of that. Hey, I want to talk about month of June.
Yeah.
Headache and Migraine Awareness Month in the month of June. And I know people that deal with that. Knock on wood, I've been very fortunate.
Yeah.
But we know what a headache is, but to have to do it often.
Yeah, it's really debilitating for a lot of people, both headaches and migraines, just because people end up missing a lot of work. It's
and then
tough.
you complicate it with a June with pines going crazy
Yes,
or allergies,
yep.
all that stuff. It even becomes. So tell me a little bit about the scope of that, headaches, migraine awareness. What are some of the reasons or things that people are having it? What kind of leads to it? A lot of it hereditary?
Yeah, so a combination of both, right? So number one, you hit part of it. Sometimes allergies. Honestly, sometimes people can get a lot of headaches just from chronic stress and tension because
There's
get so
none
much
of that
muscle
anymore,
tension. Right, none.
None at all. No stress in anybody's world.
Yes.
But yes, you do hear that being a very common baseline for it.
Yeah. And then there are some weird things too. I mean, there are some foods that trigger headaches for people and some smells. So there are a few things that can do. And then, of course, they can be idiopathic, which means they just come out of nowhere and nobody knows why. They just have them.
Well, we're fortunate today. I mean, I know my mom, red dye.
Yeah.
Well, that's gone now, right?
Yeah. Yep.
So, I mean, but there are things that you may be eating. There might be some allergies or some reactions that you're having. The month of June is bringing awareness to it. Maybe it's time to do another dig in.
Yeah.
Dive in and see if you can find out what it is. But there are some common triggers to migraines.
Yeah. So migraines, too, same thing. I mean, they can come from anything. But migraines, honestly, a little different from headaches. Headache often is just like head pressure and tightness, but migraines, often people will get a lot of systemic symptoms. So they'll get nausea, blurry vision. You can get some weird spots that you see. So people even sometimes throw up with migraines.
The medicines are much better too, aren't
yes,
they? They're a lot more, not as much of a dose, not as damaging to other parts of your body or organs, and quick.
Yeah. Yep. You can really take some that will take effectiveness pretty quickly.
And going back to headaches and migraines, but maybe more the headache than the migraine side. Usually, if I have a headache, my body is telling me slow down, take a nap, catch up.
Yep.
Take a breath. It's pretty common denominator, and most of the times the stress side of it, or you just overdid it. You're too busy. So sleep often. Yeah,
sleep is a big one, and sometimes even hydration too. So a lot of times people will get just plain headaches from dehydration. So those headaches start. Rest is important. Water is important.
Oh, absolutely. And we've had plenty of hot days.
Yes.
I mean, so the heat and the environment itself can kind of bring some of these issues on.
Yep.
Yeah, so hydrate a lot.
Yes.
I mean, been there, done that.
Yes.
When you say, oh, I should have drank some water before I took on this project and I didn't stop. Take a time, take a breath, hydrate, and continue with your project. The migraine side, a little bit more complicated, probably.
Yeah, yep. And those are sometimes a little harder to figure out what causes them. I mean, they really can be just genetic. So some people are just prone to get them.
So how do you know when you cross over from the chronic, maybe a headache from time to time or a migraine from time to time? What are some of the flags that crosses you over to, hey, we've got a serious issue to look into here?
Yeah, so really some of the big things that, just like a headache, that is the worst headache in your life. Sometimes people can have like a pounding or throbbing in there. Those are usually pretty significant signs that you need to get in. And then, with a migraine, you can get kind of this photophobia, this blurry vision. But if you really have significant vision changes, or sometimes like it'll almost seem like a black curtain is coming down over your eyes, those are important things where you need to get to the emergency room right away.
You could be looking at potential stroke starting. Yes. You could be looking at a hemorrhaging type thing. Not to scare anybody out there, but these are the signs we're talking about. It is Headache and Migraine Awareness Month.
Correct.
So we're pointing those out. But at that particular point, you really ding, pay attention.
Correct.
And seek some care.
Yes.
And the primary care at CHI St. Joseph's Health can do that for you.
Yes. Yep.
And if it comes on a weekend or something where you cannot schedule an appointment, ER.
Correct.
Yeah.
Yep.
Yeah. So, I mean, red flags you talked about when you start to see the headaches, if you've never really had them, and they start to crop up, or you got this little light nagging one that just comes around. I'm guessing it can be something that shows up that's like boom, boom, boom. Hey, what's going on here? Mm-hmm. Figure that one out if you've never really had them. And then if you got that light little nagging one that you've never had, it could be just pressure of something that just needs to be looked at and figured out. I mean, could be eye pressure, could be a lot of reasons for it. Check it out.
Yeah. Yep, exactly. And that's just it. There are people that, of course, have chronic headaches, but whenever the features change or they have something new with it, those are definitely symptoms that we really take seriously too, that there probably requires further evaluation with it. And eyes, of course, too, we didn't really talk about that, but we can get headaches if we need glasses or our vision is off too. Mm-hmm. So those are important things too, to make sure you're...
Cataracts triggered it for me.
Sure.
I mean, as an example, because I was straining more with the eyesight I was doing, and it had a little cloud, so I was working harder at it, and stress of trying to see created that pressure and some pain. So, I mean, so can be a lot of reasons.
Yeah.
And eyesight, it could be just simple thing. Get some glasses.
Yes,
Get some contacts.
Yep.
I mean, same thing for kids, same thing.
Yep.
And that where you would kind of figure that out. Okay, when did it come on? What's the onset of it? What's doing it? And the quick vision test maybe say, okay, we might have more follow-up here. And then if you need to go the next step, you got CAT scans and all that, I'm guessing.
Yep, imaging, blood work, there's all sorts of things. And I should just mention too, just because we of course live in northern Minnesota, but honestly, Lyme's disease can cause migraines.
I've heard that
too. So that is a symptom that people don't always think about. But if you also all of a sudden get weird migraines or something, that's another thing just to consider is a possible tick illness.
So ding, ding, listen to your body again, right? If your body's telling you something, go find out why.
Yes, exactly.
I mean, don't put it off.
Yep, it's an easy blood test. We can get the tick panels figured out pretty quickly.
Well, the ticks are out.
Yeah, it's been terrible this year already. We've seen plenty, I'm sure. I've seen plenty. I'm sure the ER has seen plenty. They're everywhere.
Yeah, and then, of course, could be, allergies that are setting it off, too, and things like that. So let's take another step. What are some of the things that you'd be looking to add if they have a migraine, for example? Let's go to that to give them that relief. I'm guessing the medicines, like we talked about, are much, much improved.
Yeah. So there, of course, we always start simple with people right over the counter, Tylenol, ibuprofens. Those usually really work well. And then there are some drug classes that help. Often just oral medications that either one you take at the onset of a headache and you can repeat in a couple hours if it hasn't cleared up. We also do treat some prophylactically. So some medicines that people actually will take every night just to prevent the headaches from coming that do work well.
So what are some of the treatments that potentially that are kind of new, innovative to help with migraines?
Yeah. So of course, as we talked, a lot of the new medications, but we have recently just started doing that, and I've been doing them here at St. Joseph's, but you can actually do Botox, and not quite the same as that people are getting, but they have really found that we can do Botox treatment to basically some trigger points throughout the face and in the scalp that have really helped alleviate migraine headaches for people.
Is that because the nerve endings are there, or the tightening of the face? If you're always walking around with that scalp face, is it the pressure? Is it overall?
100%, yeah. So really all of these trigger points per se are helping to relax the muscles, and it's really been a game changer for many people. So, and this, of course, is for the severe migraine patients that are experiencing more than 15 headaches a month and have failed some of the other typical treatments. But, and then insurance will cover it. And it is something that you do every 3 months, of course, but it has really been successful. And like I said, really giving people their lives back.
Yeah. So just as a joke, quit scowling and smile.
Yes,
right?
Kind of, right?
Yeah. But those are the innovative things you're finding out, not only with the GLP-1s and all the things that they're anti-inflammatory laboratory,
Yeah.
all the things they're finding out in the medical field right now, this is really because they went through an extra step and said, we should try this, and experimental in some cases, but having good results. Same thing with Botox.
Right? Yeah, it's not really just to get rid of your wrinkles. It really does have some significant improvements on lots of chronic medical health issues for people.
Yeah, and I'm familiar with it enough through my mother-in-law with having it for her eyes.
Yeah.
How it helped that. So, I mean, so definitely there's other very unique methods that help with that.
Yeah, too.
And I mean, I'm guessing every patient responds differently.
Correct.
So, I mean, it's not you're hopeful that when you find out what it might be, that you take the particular medicine and that resolves it. But sometimes it's complicated and it takes a series of things to try before you get it figured out.
Yep, exactly. And sometimes then you have to do sometimes some injections for people if they just can't quite get it figured out, either that they take at the onset of migraines, so whether it's one of the pain relievers or something called Imitrex that they'll use, they just can do a shot. Same thing if it seems the oral medicines don't help as much.
Yeah, I mean, in some of the worlds too, that people I know that have had it, migraines, take it, and it's like boom, fixed.
Yeah.
I mean, so hopefully if you have that chronic condition, that a simple thing like that would be, sometimes though it might be other medicines you're taking that are causing this problem. Then you try and fix it with this, and it takes a little bit more effort or work on your part, and also with the medicines that you're doing in a medicine panel, and say, okay, we might have to do this or this or this. I mean, that's complicated.
Yes, exactly. Correct. Right. And I tell people honestly, like anything, either natural or medication wise, there can be side effects. So that's exactly it. Then you have to make sure that it's not something else causing the headaches. And of course, if that's the case, you're going to quit that first. But it takes a little bit of digging sometimes to find out what could be doing it.
Good success rate if people get on it early.
Oh,
yeah. So I mean, while you might have this condition, and you're saying, well, you're going to have to just live with it. No, you don't.
No, yeah. And a lot of times I'll have people, even when they first come in, headache logs, just to kind of see if they can figure out triggers, right? Because that is just it. I mean, sometimes red dye 40, there are some certain things. I had a patient once, legit, it was like a soybean oil, right? So just super random, but every time they had this specific type of chip or whatever it was, then they would get a headache. So a headache log is a great thing to start with too.
That's good.
Sleep,
and what you ate, what you did.
Yep, all of that stuff to see if you can find a trigger.
I mean, and how often does like a trigger of a headache or a migraine condition that it feels like a migraine, or that you have, that it might be the onset or the start of diabetes or something else? I mean, I'm guessing then a blood panel would immediately say, okay, we have this going on, but really this is probably the problem.
Yes. Yep, exactly. So that's just it. And even headaches can be caused by high blood pressure, right? So people don't always know that, but
been there, done that.
They'll come in and they have these headaches, and you check their blood pressure and it's through the roof, and you get their headache, or you get their blood pressure down and the headache go away.
Yeah, and they enjoy a much better life.
Yes. Yep.
Yeah. So that's so many things to talk. I mean, we could go on for hours and hours about it, I know for sure. But beyond injections and other treatment approaches and resources, people are struggling, of course, chronically with that. If they are, CHI St. Joseph's is there to help you too.
Oh yeah, absolutely. A great crew there, honestly.
Yeah, because there's sometimes that it is just a chronic condition that takes a lot of effort to mitigate, and potentially just takes time or the right medicine to correct the condition or make it better.
Yep.
Yeah, but sometimes there's no real answer.
Correct. Yep. Yeah. Sometimes they just happen, and we've tried all of the things and done many medications, and it's tough for some people.
But it's always changing the medicine. So I've always been a firm believer in, on a personal level, that, there's always a new treatment potential that's out there. They're always finding cures for many different things. So the thing is, get yourself in a condition where you can have some normal life and then wait for that next drug. Because if you're doing it or having this condition, others are probably having the same, and you're hitting a wall. Or the medicines are not effective like they used to be.
Yeah.
Some of them are that way.
Yep, exactly. Yeah, I mean, I've been practicing for almost 20 years, and the medicines we use now are definitely different than when I first started. So
that's got to be a heck of a curve to stay on top of.
Yep, you're always researching and always learning.
Yeah, that's what's nice about the medical field. I think it's always challenging.
Yeah.
And staying on top of it is you really have to love it to do it, to stay on it, to be good.
Yeah.
Yeah.
Yep.
Yeah, that's awesome. So some of the closings for our listeners to learn more about our primary care services here at CHI St. Joseph's when it comes to headaches and migraines, how can they connect? How can they get connected with CHI St. Joseph's Health and their primary care clinic?
Yeah, so of course you can just look us up. So you can call the number 218-616-3900.
Yep.
Look on the website.
Website's
Facebook,
easy.
Yeah.
CHISJ.org.
Yeah.
And all of it's there.
Yeah.
And you can't go wrong with it. Beth, thank you so much for taking the time out of your busy schedule to run away and come and visit with us and share your experience with primary care here at CHI St. Joseph's Health. Thank you for all the great things you do.
Yeah, thank you.